Hi everyone, welcome to researchmd.com. We got a great presentation today. Today our topic is marijuana use and risk of testicular cancer. My name is Pramil Cheriyath. I'm a physician. I work as a program director, internal medicine residency program, translational residency program, also director of research, and I hold 2 assistant professorship at 2 major universities. So let's jump into our topic today. Our topic is marijuana use and the testicular cancer. Is there a link? Okay. So if you look at marijuana, this is one of the most commonly used illicit substance in the United States. Many states have decided to make this legal. So the popularity has increased, especially in the young people, and the usage rate. If you look at the usage rate, it doubled from 2000 to 2014. You don't have the one after that, but I'm pretty sure it tripled now. And what it has like carcinogens, just like the tobacco smoking. What are the toxic gases? Reactive oxygen species, polycyclic aromatic hydrocarbon. These are the one actually causing the damage, just like when we smoke, and that's what causes cancer. So the main component, or tetrahydrocannabinoid, is a primary psychoactive agent, have adverse immunomodulatory effect associated with the cancer. So what is testicular? In this study, what we're looking at is like a scientific study. Is there a link with the testicular cancer? Now let's look at testicular cancer. If you know, testicular cancer is more in the younger age group, right? The age group, if you look at it, is like 15 to 34. There are 2 types, and germ cell tumors around like 90%. With early recognition and effective treatment, overall survival rate is 97%, okay? What are the other risk factors? Usual risk factors are undescended testes, family history of testicular cancer, age, ethnicity, men with infertility also at high risk. So when we look at it, so the next one, what is our objective? Objective is to assess the association with the marijuana use and the risk of cancer development. So we did a literature search, and we found this great meta-analysis on the study, and this is what we're going to look at. It was published in the JAMA. Anytime when we talk about meta-analysis, the scientific evidence go really extremely high, okay? That's at the top of the evidence scientific support. So we're going to look at the scientific study done in JAMA, and we're going to talk about it. So it's a meta-analysis. So in this meta-analysis, what we do is they collect a lot of different studies, and then a pooled analysis to look at all together the combined effect and see if there is a difference. In this, there's 25 research studies, and there's like 4 prospective cohort study, 19 case control studies, 1 retrospective study, and 1 cross-sectional studies are involved. Okay. So this is the results. If you look at it, when we look at it, you can see at the bottom the diamond shape. It's on the other side. That means it's more than 1. We're looking at the odds ratio. When we talk an association between an exposure and a disease, in the exposure here is marijuana, and the disease is a testicular cancer, right? So we look at the odds ratio. Anytime when you talk about odds ratio, if it include 1, it's not significant. So if we can see on the right side, our last diamond shaped analysis kind of towards the right side, so it is significant. There is significant association between marijuana use and the testicular cancer. So our results, more than 10 years of marijuana is associated with the developing testicular cancer. Which type? Non-seminomatous testicular germ cell tumor. Odds ratio 1.85. That means you're more 85% more likely to have testicular cancer. The confidence interval is 1.1 to 3.11. It did not include 1. You can look at the p-value is 0.04. Anything below 0.05 is significant. Okay. So what are the strength of this strength of this scientific study? One is meta-analysis, and this one doesn't have no pharmaceutical support, and it was done in multiple countries. Weakness, most of the study is not like a randomized control study. This would be very strong if it was a randomized control study. Okay. In conclusion, Long-term marijuana use is associated with the development of testicular cancer. Okay, so we need to be careful about testicular cancer and when people use marijuana use. And more screening should be done to screen for testicular cancer in this group of people who regularly use marijuana. Thank you very much for joining us.